Good afternoon, everyone, and thank you for joining us today for our last SHIP Care Transitions webinar. This is Shelby Hornbach here at the IHA office, and Tina Hilmes with the Center for Patient Safety will be presenting for us today. First, I just want to thank everyone for their continued participation in the Care Transitions project. It's been a wonderful project, and we're excited today to share some sustainability resources, but also share a little bit about what your fellow hospital members have been doing throughout this project. So we are excited to present that. First, I just want to remind you that there is a chat feature on this webinar. At the bottom of your screen, there's a little bubble that says chat. If you open that up, you can see a message from me just asking that you type your name and organization into the box so we know who is with us. And then you can use that throughout the presentation should you have any questions. Also, if you have any questions, you can unmute your computer audio at the bottom of your screen, or if you're dialed in on your phone, you can type *6. But please do not put us on hold. We will hear your hold music if that does happen. We also want to remind you that the SHIP wrap-up webinar will be hosted on May 22nd from 1 to 2:30, and that is Eastern Time. You should have received an invitation from me and a reminder invitation within the last few weeks. So we just want to make sure we have everyone on that call. It's going to be a great informative call to hear about all the SHIP projects and what everyone has been up to throughout. So with that, I'm going to go ahead and pass it over to Tina. Again, if you have any questions throughout, go ahead and type those in the chat box.
Thanks, Shelby. Good afternoon, everyone. I hope everyone is having a great Wednesday and that you all are not receiving the storm alerts that we are receiving here. Anyways, moving forward, it is our last webinar, and I'm excited for that. And I'm also excited because I will probably be able to give you back a few minutes of your day today. So let's start off with what the project goals were for this. Okay. So the project overview and objectives were to provide training and tools for hospitals, ECS, and emergency medical services that support the transition of high-risk patients, especially those with chronic diseases such as COPD, to increase your knowledge of just culture or shared accountability, as we like to call it, and then to develop and share communication tools and techniques. So today we're going to really focus in on spread and sustainability of your project. So the objectives of today's presentation are to understand sustainability and how any gains made in this particular project can be sustained to support the development and growth of your tools and your processes. To review key components of projects, of how you spread a project, and then to discuss how to spread the intervention to other units or organizations. So what is sustainability? So sustainability really looks different in every facility, but some basic foundational components of sustainability include the fact that your project achievements are maintained or improved upon even after the project ends. That any protocols or tools that were implemented as a part of the project, that they are implemented or integrated into your daily workflow. And that support continues at the local level for the training and development of project champions, not just for this particular project, but to ensure that the culture of your organization is such that you continue to develop and train project champions for whatever quality improvement projects you have going on. So factors that influence sustainability include effective intervention. So was the tool or the process that came out of this project, does it work? Or does it just add an extra step? Is it bulky? Does it not really effectively show what you're trying to do? Can you streamline it or merge it into your existing programs and services? So if you already have kind of somewhat of a handoff process, can you smoothly integrate in any new processes and any new tools into your current practice? Do you have the capacity to continue to build leaders and to develop leaders that can keep this process or this quality, this project going forward. And then also, as you look at other factors, are how does this influence outside healthcare providers? How does your community play into this? Does this project provide an improvement for your patients in your community? Does this provide a good interaction or a good partnership for other healthcare organizations in your community? So earlier in this project, I think it was maybe back in December, we talked a little bit about leadership. And as I mentioned, champions in leadership going forward in regards to sustaining a project or sustaining the tools and the processes that were developed as a part of this project, that really means, are you building capacity? Is someone going to continually support high quality transitions of care? Is your leadership on board? So, as this is mentioned, do you have ongoing support? And then as a second component, are you evaluating your culture as a part of ensuring the implementation of processes and other patient safety practices? Not just, again, for this project, but the culture of your organization really plays a huge part in whether a project is going to be successful or not, and if the tools or processes that come out of a project, if they're going to be sustained and implemented into your daily workflow. And maybe identifying cultural barriers and addressing those as you're trying to sustain the projects. The components that came about as a part of this project really play a big part. You need to be able to overcome those barriers so that staff really accept the change that was implemented as a part of this project. Change can be very scary to a lot of people, though currently in healthcare, it seems like change is the norm on a daily basis. So as you plan for sustainability or for keeping the tools and processes that came out of this project, keeping them permanent, keeping them ongoing, you need to identify any resources that you might need post-implementation of a new process. If it's a new policy, do you need to share it on the intranet? Do you need to put it into a policy and procedure manual? Do you need to integrate it into your orientation flow? Select the mechanism for integrating this process into the daily workflow. Whenever you start something new, it always takes almost either a scheduled set reminder, like either on the phone or on a computer, or typed into, if you've got a paper agenda for regular meetings, making certain you've added that into the template. But then as you start doing it more and more and more, it becomes habit. So what can you do as an organization to get this integrated into your daily workflow so that it becomes habit? And then make certain that you assemble a team that will take ownership of this particular project and in sustaining the work, and then making certain that it is put into places that it will sustain the process that you put into place. And then what is next? Once you've achieved success and you've got the steps in place for sustainability in one location, let's say it is the ED, what are you going to do with that? Are you just going to keep it confined, the handoff tools and processes, to the ED, as they have probably the most interaction with EMS, with some of the handoffs, and they're usually the unit where truly nobody stays in the ED. They always go somewhere else from the emergency room department. Or are you going to spread these tools and processes that you've developed to other units, other organizations? Why don't you look to see where you can spread this practice, the successes that you had with this project, with not only within your own hospital, but maybe with other hospitals. Maybe you utilize other, more than just one extended care facility and one EMS agency. So sharing what you've developed and what your successes have been out of this project with other healthcare organizations in your community. So as you talk about spread and spreading your project, kind of defining that means taking the process that you have implemented and taking the tools and the process change that you've developed and spreading it from that pilot project to a larger group. So whether it's spreading it from the ED to other organizations in your hospital, or spreading it from the ED or your organization to other hospitals, you're taking it from a small pilot group and trying to identify how you can spread it to other areas. And then trying to formalize a process of spreading a successful project that also provides a reference to other projects. And it also provides and formalizes a process for implementing successful change to those new to your organization, and also to those who may be a little confused about why you're doing what you're doing. So you need to look at how you're going to do this and identifying areas. And so why do you want to spread? You might be asking yourself. When you think about it, and this is something that I think all of us can identify with, healthcare culture is local. The personality of your emergency room department is different than the personality of, say, your floor or the personality of your ICU. And it's different from the personality of the EMS staff who are bringing you patients. And it's different from the personnel at the ECF that you interact with the most. And even the personality of the ED of Hospital A is different than the personality of the ED staff at Hospital B. So when you think about all of the quality improvement projects that you've been doing recently, it's usually on a local level, utilizing quality improvement tracks like Lean Six Sigma or the PDSA. And so it's really targeted at that unit level and who you're interacting with. And so what we need to do is then continually shift the paradigm. Let's slowly get to that team culture. And by working on more and more collaboratives and working with other healthcare providers out in your community and spreading it to other units in your hospital, you really are changing the paradigm and changing the culture from one of a hierarchical type of culture to that team culture, that it doesn't matter if I'm in an extended care facility or I work in the ED or I work on the floor or I'm EMS or an EMT or a paramedic. We are all here as a team to provide high quality care for the patient. So by spreading it, we really do change that culture and start getting those collaboratives together. So you need to think about, as you are spreading it, you need to have a framework upon which your spread is going to be based. So a good framework starts with leadership, as was mentioned in the webinar back in December. Leadership is vital to everything. Staff see what leaders really put as a priority. And if leadership doesn't buy into a certain project or process improvement, then the staff is going to see that. You need to identify a leader or an owner for the project that is in the leadership team. And then day-to-day proponents of the change need to be identified. And these would be like leaders, frontline leaders who are really engaged and really focused in on improving quality of care. The topic that you want to implement for change, just like our transition of care, needs to be processes and tools that are evidence-based. So you develop the case, you describe the ideas. Then the setup is kind of like your communication. How are you going to identify the population that this affects? This affects our patients who are transitioning from one area of care to another. Who are your adopter audiences? Who do you want to reach out to? Who do you think would be successful sites? Identify your key partners and identify an initial spread strategy. How do you want to start out? Do you want to start out spreading it to just one other area, or do you want to tackle spreading it to 3 or 4 different areas at a time? And then as you are moving on, you need to identify, like, your social system would be that support team, like who will be your key messengers, who are the communities involved, do you need technical support, and what might be potential barriers in transitioning from where you started this project to spreading it out to a larger area. And as you think about your spread framework, you need to have a way to measure the spread and get feedback in regards to the spread, because you may have to tweak your processes a little bit because of the personality of where you started it. And then you need to have a way to manage your knowledge that you've gained from the project. And just like with sustainability, there are factors that affect spread. There are both external and internal factors that affect spread. So as you are making your plan for spreading the project out to other areas, think about, are there financial factors that might affect this? Are there legal factors that might affect it? And then regulatory, think about HIPAA and PHI and how to make certain you're following all those regulations. How public opinion might affect this. How do you think the community would view a project that does include everyone in your community and not just within the hospital? Of course, is it a moral project? But then also identifying any external priorities that might put up a barrier to the spread of this project. So as you are thinking about what to do with this project after you've maybe had some successes in the local areas involved, think about any external factors that might be barriers to spreading it outside of your local area. And then there are also internal processes that affect spread. And so these include leadership. You have to have someone taking ownership. You have to have buy-in of leadership. Whatever you're trying to change, whether it's this project or other quality improvement projects, you have to ask yourself and the team involved, does this align with our mission, vision, and values? Is it able to be coordinated with other quality improvement initiatives? Do we have availability of resources? Are there sufficient resources to put the new processes and new tools in place? Will the new process require staff training? I always think about this, and I'm certain you've all heard the saying about, if you really want to learn something, teach it. And so that's where I think it's really exciting in healthcare as we start working on different ways and utilizing different tools to improve our quality of care. If you are assigning someone or identifying a leader within the frontline staff who is extremely engaged, by giving them the opportunity to teach it and be a leader with helping with the spread and sustainability, they learn even more, and then they inherently become an expert in that area. So knowledge and skill set needs to be looked at as a factor affecting spread. What is your organizational culture? Are there barriers to change within your organization? How can you identify those barriers? And how can you show your staff that this will be a strong improvement for quality of care? Sometimes frontline staff, they're very many of them are very clinical, and so they're very results oriented. And so they want to, quote unquote, see how the change is going to affect patient care. And so that's always a really big factor to overcome sometimes. And many times it's in the storytelling. If you can share a story with your frontline staff of an area where handoffs did not go well, and then provide an example of where handoffs did go well, that really makes an impression to them. If you've got a real life scenario, or you have a patient who can come in and share either a poor handoff or a good handoff, that makes even more of an impact to your staff. So identify any organizational culture barriers you might have, and look at your ongoing improvement efforts and make certain that transitions of care really fit in with other improvement projects. What we have seen is sometimes hospitals get so bogged down in so many different quality improvement projects that are extremely different from each other that they all either fail or only one or two succeed and the others fail. And so if you can make it the priority choosing quality improvement processes or efforts that really kind of integrate or mesh with one another, that kind of helps to ensure that the success of all of your projects. And then identify if there are any other priorities that might prevent the spread of the tools and processes that you developed. So as you're thinking about spreading your processes, your tools, keep these components in mind and think about what might be a barrier to spreading this project. So things that really do help make spread a success is making certain that your tools are evidence-based and that the examples you use are also evidence-based. So when you look at some of the things that we shared with you, such as the standardized handoff tools, the MIST tool, the IPASS, these are all tools that have gone through testing and have evidence behind them and research behind them. The communication techniques in TeamSteps. TeamSteps has been utilized by DoD for over 25 years. So it's got many years of research and utilization in place. So you know that those have gone through testing and the rigors and that they do have the evidence and research behind them to be successful. Again, leadership support is extremely important for a successful spread. Make certain that the tools and the processes you've developed are easy to adopt. Make certain that any changes you're doing or any type of improvement project you decide to take on really is a pertinent and relevant issue. Make certain that it can be piloted or tested on a small scale before you try and spread it to the whole organization. And then make certain that the change is observable or measurable, that you can really see the improvement or somehow measure the improvement, whether it's through quarterly meetings, reviewing each transition of care, however you decide to make it measurable, make certain that the outcome is observable and measurable. So as you're talking about spreading it, there's also a sequence you kind of need to go into, and it kind of plays back into the slides that we've just talked about in regards to what facilitates successful spread. You have a theory and an idea of what will be successful. So tools and processes to put in place for improved quality transitions of care. You test it, you implement the change in a small local area, and you test it under a variety of conditions with a stable transition, with an unstable transition, with someone with a chronic disease like COPD, someone who's more stable. You kind of tweak your tool, you tweak your processes, and then you put it into part of your routine operations. You put it into your daily report out. You put it into your shift change. You make it part of the policy for every handoff that you do so that you're reporting on it and you're making it part of that daily routine, that daily workflow. And then you've got your sustainability components in place. So then you can start thinking about how to spread it to other locations. So then you get the sequence and change, and then some foundational steps for spreading a successful project are 4 steps, but you need to revisit these steps each time you want to spread a successful project. One, first off, as you're doing a new quality improvement project with a small localized team, inform the team that they are a pilot project and that you want to try out some new processes, a new tool, and that you will be spreading it on to the rest of the organization or to other organizations or sharing it with other teams so that they feel encouraged to give feedback, whether it's positive or negative. You need to then start working with the next unit as you're finalizing and putting the processes in place in the first pilot unit for sustainability. You need to start identifying and working with the next unit so that they are aware of what's coming. You need to assess them and account for variability. As I mentioned before, every unit has its own little culture and personality. So you might have to tweak the steps a little bit to fit a different unit. And make certain, lastly, that you are starting with units that adopt change easily. If you start with those successful early adopters first, then as you're spreading it throughout your organization or with other healthcare providers throughout your community, they can see that it has been successfully implemented at other organizations, or if it's a unit that is slow to change, they can see that other units have adopted the change easily. So then it becomes easier for it to become a success in other units. So in summary, any prior work you've done, either before or during your current project, and specifically with this one, any tools and processes that you've changed to improve transitions of care, those processes and tools need to be leveraged to support the sustainability and spread efforts. If you have successfully completed a previous quality improvement project, look back at what you did to implement it as part of the daily workflow to support sustainability for this one, and look at what you did with that previous project so that you can successfully spread this throughout your community or your hospital. Understand that project spread is influenced by both internal and external factors, and that spread plans are unique to each different team. And then understand that collaboration is essential to ensure a successful project spread. So with that is sustainability, some components of sustainability and spread. Now I'd really like to kind of go into the hospital report out, a few organizations, some slides, and I cannot tell you how excited I am about these. It sounds like some of the webinars made a greater impact than others, but it was just so exciting to see what everyone has been doing as a result of tools and education provided. So the first one is Greene County General Hospital. Woo, woo. Give a shout out to yourself, Greene County. So what implementation strategies have you used as a result of your SHIP project? They reported out that they have increased communication with their EMS provider, and that the EMS communication has helped decrease some barriers of transportation for ECF patients. And I can't tell you how important I think that is and how fantastic I think that is. Our ECF patients are some of our most fragile and vulnerable patients, and so to overcome any barriers is just fantastic. And then to add transition of care to your continuum of care meetings, I think is great also, because how can you help a patient move along the continuum of care if you truly do not address the idea of transition of care? And they identified 3 to 5 successes as discussing team steps interventions with department leaders. And I think that is very exciting. The team steps tools really do help support a strong patient safety culture and really do help to open up communication within departments. Inviting your EMS provider to your quarterly continuum of care meeting, I think, is fantastic. So many times EMS providers are kind of that forgotten healthcare provider, but they are becoming a greater and greater component of our healthcare team. You're seeing EMS really move into community paramedicine and mobile integrated healthcare. And so they are really becoming involved at a community level with helping to manage our chronic care patients. So I think that is fantastic. You've started inviting them to your continuum of care meetings. And then the last success they listed here was that project leaders multidisciplinary project leaders were able to attend webinars and in-person trainings. And I think continuing any type of opportunities for increased knowledge is always a wonderful idea. So shout out to Greene County. The Putnam County Hospital identified as successes. The institution of scheduled triad meetings with hospital, ECF, and EMS to discuss successes and challenges with patient transitions with an emphasis on making process improvements. They focused on a discussion on the number of transports and locations in 2018, the location of any equipment between organizations. It sounds like they began utilizing the MIST form and also took a look at their non-emergent Medicaid transportation. They felt there was an increased educational awareness in clinical conditions offered through the webinars, and that the most impactful was the April webinar by Dr. Jake Kieferman, and the number of reports and handoffs in the 48-hour period. I agree, that really made an impact on me. As healthcare providers, when we're working as a healthcare provider, we really do see the handoff as just part of our daily routine, nothing big. And even if we become a patient, we understand what the daily workflow is, and so we do kind of understand the need for the handoffs and maybe repeating some things to different nurses and different doctors. But it does get frustrating to patients, the number of doctors that come to see them, the number of nurses that come in the room, the number of all healthcare providers that they have to explain and say the same thing to over and over and over again. And so if we can keep in mind the number of handoffs a patient is going through and trying to find ways to minimize that, I think that would be great. Putnam County also felt they had a unique partnership already in place between hospital, long-term care, and EMS. That Miltond was an IGT partner and very close to the hospital, and that Star Ambulance was their preferred provider for transports. And that as they were going through this project, communication barriers really didn't need to be addressed because the collaborative partnerships had already been established. And this was really fantastic for them because they didn't have to address any barriers at the beginning of the project. So they were able to easily move into that open collaborative discussion. And so they were able to bring up any opportunities for improvement when the transition didn't go as expected without feeling like any fingers were being pointed at anyone or playing like the blame game. And so I think that's fantastic that you already had that partnership in place and that there really weren't any communication barriers. So you were really able to easily move to the next step. And then they implemented some communication tools such as the MIST EMS timeout that was implemented by EMS for their whole organization for patient handoffs. And then they had already been utilizing a handoff tool for hospital and SNF. And I think this is a really great idea because if you have already one tool in place, how can you support that tool and with maybe a second one specifically for EMS? So I think this is a really great idea to help support the handoff tools and to develop these standardized communication tools. They then start becoming familiar. Everyone sees them. They know what they are, so they know what's on them and what to put in them. And then Decatur County Memorial Hospital, they developed on their own an ER to extended care facility transfer sheet, which I think is fantastic. And then when they said identifying successes, that they have just begun utilizing the new form, and so they don't really have any feedback on it yet. So here is their form, and I know it looks kind of tiny, so I'll kind of go through it step by step. So it's got the patient's name, date of birth, who their primary care physician is. If they called the primary care physician prior to transfer, they have a yes or a no that you can circle. If you circle the no, then it says it was an emergency. Who was the nurse or contact at the extended care facility? And you're writing there, I am sending the patient to the ED because of the following symptoms or issues. So you have a place to put down what the symptoms were, and then the last line says symptoms started. So you've got a time frame here of when the symptoms started. And then prior to transport, it says I contacted either the primary care physician or the on-call physician, and you put a name, and then it continues and received / or performed the following orders or interventions. So again, great. A few lines for pertinent interventions, what has been going on just since the beginning of the symptoms. And then it puts what the patient's level of care is. Are they in assisted living, skilled nursing, or long-term? And then what I think is even more phenomenal is they put down what the patient's baseline status is. Because so many times, if it's a patient coming from an extended care facility and the hospital doesn't know the patient, then they're trying to get them back to a fully cognizant state. But it could be that the patient's baseline status is that they are slightly confused. And then they've got a few lines for other information pertinent to patient care, which is a great place to put allergies and anything else that is going on with the patient. And then lastly, it's got some area for labs that have been taken in the last 48 hours. I think this is a really great tool, and I'd love to hear how Decatur County came up with this. I see there's been a lot of stuff going on in the chat box. I haven't really been paying attention. Shelby, are there any questions or I need to answer?
You're right. That's been a lot of activity in the chat box, and it's all just been celebrating what Greene, Putnam, and Decatur have all been doing. And I think it was really cool. Scott, that partners with Decatur County with its EMS, said the form is working very well, and there's better communication between ECF, EMS, and the ER. And I think that's incredible to hear. So thank you, Scott, for sharing that.
That is fantastic. I love hearing all those stories. I think it's just absolutely fantastic. Darcy, is Darcy on?
I believe Darcy is on. Darcy, if you want to share anything, you are more than welcome. Oh, she is on. If you want to, you can unmute your phone line or your computer audio and talk with us, or through the chat box. But I know, Tina, if you had any questions.
I was just curious how you developed this tool. I really like it. And I like it's all in one page, so it's simple, it's to the point. So I was just curious how you developed this. Did you reach out to your extended care facility partners? Did you include EMS? I was just kind of curious how you put together this tool.
Can you hear me?
We can.
Oh, yes. Well, I think it was kind of started before we were in this program, but I think Scott had used a sample that was distributed in one of the conversations that we had with all of you.
Okay. Okay. Well, I think that's just so fantastic. I can't tell you how excited I am to see all of the communication going on between hospitals and extended care facilities and EMS. I just think that's phenomenal. And I love the fact that you guys are sharing everything. So I'll go ahead and wrap up. I've got some resources here. So if you are interested more in ideas and ways and actionable items to help spread this, many of the components were taken from IHI framework to spread, and then also from CUSP collaborative project. I don't know if any of you have ever been involved in a CUSP-CADI or a CUSP-CLABSI project, but they always do presentations on sustainability at the end, and so they have some great resources. This paper, Applying the Science of Improvement to Daily Work, was also a great resource. And then if you do get an opportunity, check out the CUSP Toolkit. That's got some good resources for bringing teams in together and developing teams, and it really integrates well with TeamSteps for those of you who might be thinking of utilizing some TeamSteps resources. And then if you have any questions, please feel free to reach out to me or to one of the team. If there's long-term care facilities or EMS agencies that have questions, I'd be more than willing to direct you to Kathy Wire or Lee Varner, who are our long-term care expert and EMS expert respectively. Feel free to type in the chat box any, oh, I think I just left the meeting. I'm sorry, guys. I was trying to get to the chat box.
That's okay. I can pull up my slide for you, Tina, so we can just have that there. But in the meantime, if you do have any last minute thoughts regarding the project or any ideas you have to share with other hospitals, please go ahead and type that into the chat box. But Eunice from the Center for Patient Safety, if you don't have your chat box up, she sent a wonderful note that she met many of you during the face-to-face meetings back in January, and she just wanted to say, way to go to each of you as you made so much progress. We hope that we can share some of your tools with other EMS, long-term care, and hospitals across the U.S. to help improve patient care. Keep up the good work. So I think we all can agree with Eunice that thank you to all of our participating hospitals as you completed some wonderful, wonderful work all across the state of Indiana. So we cannot thank you enough for that. And we are always a resource to you, so feel free to reach out at any time, even after the project is over. Reach out to any of us at the Center for Patient Safety or at Indiana Hospital Association, and we'll be happy to help you. But again, just a reminder that that wrap-up webinar for the SHIP project is on May 22nd. And I think we're going to hear again from Decatur, but we'll also hear from all the other projects that were going on with the Small Hospital Improvement Project over the past year. So we're excited to hear that. Also, we are, just a reminder that all of the webinars that have happened throughout the project were recorded, and we do have PDF slides. Here at IHA, we are working on putting all of that on the website, but in the meantime, if you don't remember receiving any of that or would like a reminder for one of the webinars, please just email me, and I'll be happy to provide that to you. But we will also let you know when that is available on our website. With that, Tina, do you have anything you want to wrap up with?
I just want to say thank you for giving us the opportunity to work with all of you. I agree with what Eunice said, and I'm just so excited to see how everyone's working together. So thank you for giving us the opportunity.
Yes, and it looks like Scott, who partners with Decatur, was thanking Center for Patient Safety for allowing us to participate. So thank you, Scott, for participating. And Eunice made a great point that she's not sure any other states has taken on the Transition of Care Collaborative, and they're hoping to replicate this across other states, and they'll give Indiana kudos and credit. So we love to hear that. But thank you for celebrating. Yeah, that's awesome. We want to thank you again for celebrating with us today, and as a reward, we'll give you back about 10-15 minutes of your day. But again, please just let us know at any time if you have any questions about improving your transitions between EMS, long-term care, hospitals, whatever you need, we are a resource for you. So thank you very much, everyone, and have a wonderful rest of your day.